Better Workplace, Better Mental Health is about improving mental health and wellbeing within workplaces. There's a huge commercial benefit to improving mental wellbeing within the workplace. For example, for every £1 invested in wellbeing initiatives, there's approximately a £4.10 return. Not to mention the fact that 1 in 4 people are affected by mental health problems. Arguably, given that information, it's almost an undersight not to actually promote mental wellbeing initiatives within the workplace as part of the core functions of business. One of the key things we support with employers is developing and adopting policies and practices that support people with mental health problems, but also that provide protective factors for other employees. Workplace Health Champions programme fits quite centrally within these initiatives. Having a workplace health champion has certain key benefits. For example, having a champion allows an employer to maximise the reach of wellbeing initiatives, so it has a multiplier effect, and it also maximises that initial investment in workplace wellbeing interventions.
My role really is to offer support and advice, and also maybe organise activities for our team. We organise stress awareness workshops, and which I found beneficial in the training myself. So we introduced that stress awareness workshop to the team members, which they found really useful because it gave them the skills and knowledge to look at how to cope with stress.
One thing we have put into place within our team since I became a workplace health champion is walk-in supervisions. It gets us out of the office and we get some fresh air and exercise, and I feel we can talk more openly.
There are many things you can do to make the workplace healthier, which cost little money, time or effort. It's common sense really. The Workplace Health Champion project is made up of champions from businesses in the Doncaster area. We've started the project back in March 2010 and had an introduction meeting to see what people in the Doncaster area wanted to take forward within their workplaces. We did an activity called Speed Solutions where other businesses could give ideas to issues they was having around health in the workplace, and from them we've developed a year-long programme where we cover 2 thematic areas in each workshop bi-monthly and cover things such as physical health, mental health, men's health and women's health, cancer awareness, among a variety of other things. The workshops provide the champions with training and advice and information that they can then take back to their workplaces. Being a workplace health champion doesn't have a rigid job description, and it varies a lot on the workplace and the organisation's environment, such as if there's lots of entry roles within the workplace, you're more likely to concentrate on physical activity. The size of the organisation is also an important aspect, and the culture of the organisation and how well received health will be.
I decided to become a workplace health champion following one of the stress awareness workshops that delivered to our team, and just felt it was something that needed to be put on the agenda as we work in a very stressful, sometimes quite often negative environment, and I thought I'd like to take that forward, and I value sort of my own health. Since becoming a workplace health champion, one of the first projects, if you like, I got involved in was encouraging the staff at DIP to take part in a bike to work week, and although it was difficult to get them involved in this challenge initially, to get staff to take part, we had 5 members of staff who during that week cycled, and we won the challenge with 228 miles in total.
Being a workplace health champion doesn't mean you have to be a member of HR or management. There are certain skills involved with being a workplace health champion there, and they are things such as creativity, having leadership and great communication skills.
I'm responsible for working with staff, supporting the team leaders that manage the staff, and ensuring that staff have got the support there for the well-being to actually stay in work. I asked the Better Mental Health team, the PCT in Doncaster, to come along and deliver some stress awareness workshops for all our staff in the Doncaster office. I thought this was really important to identify any areas within the workplace where it may be issues for staff. Following on from this, we decided to do a fun day for the staff. It was done one full day. In the morning was a little bit structured. In the afternoon we just brought a Nintendo Wii in, and they were playing on the Wii games, so there was a bit of health in there, trying to get them fit, exercise. So it ties in really well with the workplace health champion role.
Having workplace health on the agenda is very important. This isn't going to happen unless there's buy-in from chief execs and management. They play an important role in taking workplace health champions forward and setting up workplace wellbeing groups. If this doesn't happen, then workplace health champions aren't going to succeed.
I'm the chair of the Workplace Wellbeing Group for NHS Doncaster. It's a group that we established a few months ago now, and it's made up of representatives from all the directorates across the organisation, including our provider arm, Doncaster Community Healthcare. We're hoping in NHS Doncaster to enable our employees to work as effectively as they can, and key to that is their health at work. What we're trying to do is support employees who have long-term health problems back to work by making adjustments, offering them phase returns and alternative working patterns.
I've been to a workplace health champion meeting yesterday, and there's a few things that have come up that are really good ideas that I'd like to cascade to the service user group. Right.
In my organisation, part of my role as champion is to give guidance and information to other staff. I'm not a trained therapist, but I don't really need to be. I now have the knowledge about support services for different health conditions and pass this information on to the other members of the staff.
There's some bits in there that I think may be really useful. And
for our next challenge at DIP, I plan to encourage as many staff to take part in the 10,000 Steps initiative, which I heard about at the recent Health Champion meeting. And this involves wearing a pedometer and just recording how many steps you take in a day, and the recommended amount is 10,000.
One of the main health issues within the workplace is musculoskeletal problems. In one of the network learning sessions, all champions were trained to do simple exercises using the exercise ball to reduce the risk of musculoskeletal issues. All the champions then took the exercise cards and the exercise ball back to their workplaces to use themselves and with other staff members. There's many reasons to look after the health of your workplace: ethical, moral and commercial. It will vary within the workplace what role your champion will take, and you'll know what suits your organisation best. But if you do want a healthier and happier workforce, more motivated and productive staff, reduced absence rates, higher retention rates and improved profits or service delivery,